One of the things I was thinking about was if someone was new to neuralgia and they had new symptoms, what tests might they have to sort of diagnose neuropathy?
So as I said, because it's all really, really, really logical in the way it works, and that's why I compared it to computer before, it's really logical or like an electrical system. So the most important test is really to have a clinical examination. So the people who come to our Cambridge clinic will know that I always examine them clinically and check their reflexes, and basically that's it. Because so if you do a clinical examination, including the reflexes, you can localize where the problem is. And from this localization, for example, if you know how we are wired up, if there's a sensory loss in that distribution of the nerve cable, that is likely to be affected. For the peripheral neuropathies, a more sensitive test, in addition to the examination, is to do electrical studies of the peripheral nerves. So as neurologists, the tests we have is we do scans of the central nervous system of the brain and the spinal cord, but the nerve cables you can't scan. So you can measure the functioning by doing electrical studies and measuring how well the nerve conducts and if that's, you know, within normal limits or not. And some patients with NF2 have those tests. So clinical examination and neurophysiological studies.
And it's interesting because I've had one of these electrical studies, and it's a really, really weird experience, isn't it? Because they kind of clip on the conductors, you know, all over your hands and further up your arms, and then you get these little sort of zaps through, don't you?
Yeah.
But when you look at the results of that coming up on the screen, it just looks like all these waves.
Yeah,
I
no,
mean, I don't know how you decipher it. It's incredible.
it's just like a normal cable, like a normal cable. So you can kind of elicit the electricity, and the electricity is then conducted through along this cable, and that's how you can see if it works.
Amazing.
And
Amazing.
yeah.
And so if you were, I mean, in any case, really, how would you treat neuropathy?
So obviously the most important thing is to find out what causes it. Okay. And so in order to find out what causes it, the first thing is to just identify whether it's a kind of generalized neuropathy, as I said before, which can also occur in NF2, which is just a degenerative neuropathy. So if we find that, one would really look for other causes other than NF2, which could make it worse. So one would, check for diabetes, for vitamin deficiencies, and if anything is found, treat that. And likewise, if we think the neuropathy just affects one particular nerve, one would look for anything that could cause that, and maybe it's a tumor which can be taken out or anything like that. So the first treatment is to try and treat the cause. But often that's not possible because sometimes, the cause can't be treated, or you can't have surgery. And in that case, you have to treat the symptoms. So when you treat the symptoms, the most important thing is to counsel the patient about what symptoms they can expect. So, for example, if you have a generalized neuropathy that causes numbness of the feet, it may be particularly in NF2 where people are anyway already unsteady, that it makes them more unsteady because they can't feel the ground on their feet. And so they need to look where they're going, otherwise they will fall over when there's something on the ground. Or they have to check their feet, make sure they don't injure them and they don't notice because they've lost the sensation. If the neuropathy causes weakness, then it is important to have physiotherapy, keep the joints mobile, and make sure that the weakness doesn't cause additional problems. And if the neuropathy causes pain, then usually there are specific medications one can use for that. As I said before, I likened the nervous system to a computer and to electrical cables. And so normal painkillers often don't really work, but it is medications which work on the electricity that is generated in those nerves. And those very often are medications that are also used for epilepsy. They just kind of calm down the electric signal in the nerves. And that's why they work for epilepsy, but also that's why they work for neuropathies.
So if it's not pain related, would those medications be used at all? And forgive me for my naivety here, but if it's reducing electrical signals, if you took that without pain, would that sort of impact neuropathy and make it a little bit worse? Or?
No, it wouldn't, but it's a good thought. No, but it wouldn't. It wouldn't, because it doesn't really affect the underlying cause of the neuropathy, and it just stabilizes the electrical signal. So a lot of people with epilepsy take epilepsy medication, but they don't slow down very much as a result of it. It's interesting. Some people say that they slow down a little bit in their cognition, but generally speaking, it doesn't really have these kind of side effects. But it's so, for example, in trigeminal neuralgia, epilepsy medications are really effective, as opposed to just taking normal painkillers.
What I find really remarkable about that, and I've just literally had a penny drop moment myself, because I started having seizures just over a year ago. And since I started taking medication, I haven't had any issues with trigeminal neuralgia. And so actually that now I've literally just had a penny drop moment. So thank you for that personally.
Sometimes it's also because what happens in trigeminal neuralgia is the underlying problem is that something touches the nerve. Once that happens, it's like almost like an inflammatory process that happens. And so if you calm down the nerve a little bit and give medication, then the inflammation can settle by itself. And anyway, it's possible that very often in trigeminal neuralgia, sometimes it just kind of improves again. If you treat it for a period, then it may just improve by itself. Yeah. So it's possible that it's the medication.
Sometimes these things are accidental as well, aren't they? So quickly going back to treatment. So I'm trying to understand a little bit about non-medication treatment or non-surgical treatment. So I know you touched on physiotherapy. How useful is occupational therapy for people with neuropathy?
So it's really useful, especially if there's loss of movement, because so if the neuropathy causes weakness, then there is a real danger that there could be other complications, which are not just the neuropathy, but so, for example, if people can't move their ankles or their toes normally and it's all kept in the same position, eventually the tendons may shorten and stiffness may result, and that can cause pain, and that cause, so having regular physiotherapy, regular stretching, and all of that is really important. And also it's important in order to keep people mobile. But there are a lot of other non-medication approaches. So obviously we were talking about pain. There are a lot of physical treatments for pain, TENS machines, for example, or acupuncture. And also there's a psychological component to pain. There are people in India, like the fakirs, who can lie on nails and things. So there is some kind of psychological aspect to pain as well. And, to kind of treat that, it's always really useful in order not to have to take so many painkillers. So it's good to explore non-medication approaches for everything as much as possible. But at the same time, some people just need to take medication.
Yeah, and this is it. It's kind of like a way up between the cost and the benefits, isn't it? You know, and I think it's one of these things, particularly with neuropathy, is you have to kind of, I think, understand where your limits are, where you can push yourself a little bit further on these things as well. I mean, we've heard lots of people talk about good diet and acupuncture and all these sort of maybe what would be considered as holistic treatments for neuropathy. Are they mixed or are they quite helpful with neuropathy?
Are quite helpful. I think they're quite helpful. And also, you know, to have a good diet is really important. Having, you know, a lot of people with neuropathies take vitamin B supplements. So that can sometimes be helpful to improve the symptoms. It's not very evidence-based. We know certain things in the diet, for example, alcohol can make a neuropathy worse. Um, it's always important to be generally fit, I think, you know, because if you have a neuropathy and then you're generally unfit, that kind of makes the situation overall worse, to be normal weight, all those general things. And yes, a lot of people find acupuncture very helpful. And it's just good to try out different things because we often don't have a cure. And so it's
Yeah.
good.
And you know, some things work well for others and don't work well for others. So I guess it's just trying to find what works for you, isn't it?
Absolutely, and it's good to have it. And as I said, so you know, it's also good to try not to get hooked on painkillers. You know, so the epilepsy medication which we sometimes prescribe are better, but it's always important to try to limit those. And if one can find other approaches to pain management, that's always better. Some people go to dedicated pain clinics and to just help them in a more holistic way with dealing with their pains. And that's, I think that's always a really useful thing.
I think just having those options is really beneficial, isn't it? And I mean, one thing I don't think we've covered yet is around temperature. Now, is neuropathy influenced by temperature? So, if you're in the cold, is your neuropathy going to be worse than if you're in the heat?
Well, I think that so the temperature sensation is part of the normal sensation that is transmitted by those nerve fibers that are affected. And so having an abnormal temperature sensation is quite common in people who have a neuropathy. So I often ask them, when you take a bath, can you feel the temperature normally? And many people with a
Yeah.
neuropathy say either they don't feel the temperature, or some people are just more sensitive to temperature changes. So when they put their hand into warm water, they feel it as perceive it as unpleasant and much more hot. Or even a normal touch for some people just enhances and could be unpleasant.
Yeah.
And so some people with a neuropathy really don't like to be in cold environments or to have, you know, extreme hot or extreme cold environments they find unpleasant. But that's not everybody. So, but that's something that, you know, some people just.
I think it's one of those things that was very strange for me on my experience with it personally, because I spend a lot of time in the sea. So I'm lucky to live in a coastal area and I go out kayaking and paddleboarding quite a lot. And there was sort of a step change for me with trying to actually get into the water, and it would feel like I was having daggers into my feet, you know, and it was random because it was just in my feet. So I didn't have it in my legs and it was really bizarre. So it was one of those things that really just totally threw me as an unexpected thing. We've had a lot of questions about, or comments with people saying that in winter their neuropathy is worse. Is that something that's quite common?
No, it's certainly something which I've heard many times. Also, what you just described, these daggers when you go into cold water, and many people with neuropathies have to warm their hands and their extremities. You know, they have hand warmers and wear a lot of socks and things, and so that's certainly something that can be influenced by the neuropathy. And the other thing is that the blood circulation in the feet and in the hands is very much influenced by movement. So if you don't move so well because the neuropathy, let's say, has caused some weakness or something, then it just makes the situation even worse, not only because of the neuropathy, but also because circulation is impaired. So moving, keeping the limbs warm, that's a good thing to do to treat those symptoms.
One thing that we haven't approached yet is about this sort of outcome of neuropathy and the sort of prognosis of neuropathy. Is it something that gets worse over time, or is it something that you can improve or even reverse?
It really depends what the cause is. It really depends what the cause is. So in the general population, the most common causes for neuropathies are, they could be linked to diabetes. If that is the case, and one controls the diabetes better, one can stop it from getting worse. They could be caused by old age, in which case they often just get worse because you can't stop getting older, or it's not a good thing to do.
We're still trying.
Some are caused by vitamin deficiencies, and you can treat that and then it doesn't get worse. In NF2, the NF2 related neuropathy that is not caused by tumors, and which is, as I said, rare. I only have one patient who has it very severely, but that's a neuropathy that can sometimes be seen, that can gradually get worse a little bit, but it is not a common diagnosis. And in NF2, often the nerve damage occurs as a result of tumors, and then it just depends how these tumors behave. I see quite a lot of people who come as new diagnosis, and for example, and I see them for the first time and they just have one leg a bit shorter and a little bit of weakness in one limb. Okay, and they never really thought about it much, and then it all comes to light when they get their diagnosis. And probably they've had that all their lives, and it's probably related to the tiny little schwannomas in their nerve roots along the spinal cord, which they had all their life. And very often that is just like this, and it doesn't really change, and it doesn't really get worse. So that is something that's quite common, in NF2. But as I said, if the neuropathy is caused by tumors that are changing in shape, it could get worse as the tumors get worse. So it depends what the cause is.
And if the tumor is the cause of it and it's removed, would that see improvements after that?
Not often not. It depends a little bit on the specifics, and it would be a matter of discussing with the surgeon, and it would depend on the specific situation. But removing the tumor would be with an aim to stop it from getting worse. And increasingly, we change our practice in NF2, and we're starting to be more proactive to look for tumors early on, which only cause minimal symptoms, so that we can be proactive about removing them before they cause problems. So
I think it's such a nature of NF2 as well, isn't it? Because we all have this sort of commonality. We all experience similar labeled experiences, but actually all of our experiences are so individualized. And I think just for our viewers' sake, it's really, really important to understand that these sort of just generalized conversations are everything. And really the next question for me, Anke, is, if I was experiencing new sensations, Would it be my neurologist in my MDT clinic that I would be speaking to about this, or would it be someone else?
No, it would be best to speak to the neurologist, because the neurologist would normally be the person to localize your new symptoms to a specific problem you may have, you know. So the first thing a neurologist would do would be to examine you, and that's what our expertise is, to examine you, and we know which nerve cable provides what, and try to localize where in the nervous system the problem is. And then, you know, you would probably have some scans and some possibly some other tests as well, but it would be the neurologist who would examine you to make that diagnosis.
Just a quick, very, very brief one is my last one, just to ask about the assessments, because am I right in assuming that when we all do these sort of tests, are they the markers that we're looking for with neuropathy, or are they for a whole of things? Because we all go through them, don't we? I mean, it's like a staple of clinic. Okay, here we go, right, touch your nose.
It depends. It's organized in a very logical way, and each part of the nervous system is responsible for something else. Okay, so those tests which you were just doing, they're probably more to measure the coordination. And the coordination is usually determined by a part of the brain called the cerebellum, and often that's affected in NF2 because of the vestibular schwannomas. So some of the tests are for that. Specifically for neuropathy, the most common test would be to check the sensation, ask, can you feel me touching you?
Yeah.
And where is the sensation normal and where is it not? And to measure, you know, like we always test the weakness of individual muscles, and to see which muscles specifically are weak and how does it, you know, correlate to how the nerves supply our body, and to check the reflexes. So in neuropathies specifically, other than, as opposed to diseases of the central nervous system, so in neuropathies usually the reflexes are absent, whilst if you have a spinal cord problem or a brain problem, the reflexes are increased.
Right.
So, you know, you should just do like as everybody with NF2 will have experienced, a full neurological examination, and that's the best way to localize the problem.
And just before we finish, because this has been such an amazing chunk of information, is there anything that you think we've not covered that you feel is really important message for people to know?
Well, I think the most important thing is to remember that it is very complicated. Okay. And that what most people refer to as neuropathy is actually not that common in NF2. In NF2, the main problems that occur in NF2 are caused by the tumors rather than degeneration of the nerves. And so it's important to try to not mix it up. And it's always good to talk to your neurologist if you don't understand it and want to have more information. And I think every NF2 center in the UK has a neurologist linked to it. And so we're always very happy to explain it.
And from a patient's perspective as well, you know, for everyone watching, I seriously implore you to communicate the hell out of your clinics. I mean, I'm one of these, I will literally ask every question under the sun, but the clinics are fantastic in providing that information when you talk to them. So I implore you, please do chat to your clinics if you're experiencing any of these symptoms or any questions you have or anything like that. And honestly, I cannot thank you enough for joining us today. I really, really appreciate it. And thank you for all that information as well. So everyone, this is the end of the episode for today. Thank you for watching. Don't forget to click on subscribe on our YouTube channel. Also check out our other videos. We've got a whole host of topics out there as well. Until next time, see you later.